Ronnell Nolan, President, CEO, Health Agents for America, having a little fireside chat, and the only fire that's around is the fire in my heart. Testified this morning about balanced billing, a new bill by Representative Freeman that I was very encouraged about. He not only included benchmarking for the insurance companies, but included arbitration for the physicians. I had to leave a little bit early because I had a doctor's appointment, but I listened to the rest of the testimony on my phone. Because there were amendments that were added, the bill is going to be heard on Thursday in its totality to be voted on by the House Insurance Committee. And then we still have Senator Talbert's New York baseball style arbitration bill that is headed to Senate Finance tomorrow, and I will be in that meeting also. Basically, what happened in Senate Finance on Monday was that the senators asked for a more refined fiscal note because the fiscal note is huge. We know that the fiscal note is going to be huge because everything that we read says New York's baseball style arbitration is increasing rates. It's hard for people to understand, and I hope that I can make this clear. There are three parties to this team or to this game. The one side is the providers. That includes the hospitals, the doctors. The other side is the insurance companies. And I represent the consumer, and I'm going to say that we're the ball because we're the ones that are being hit. And that's what I've tried to get across, and I hope that I have been successful in getting across that the consumers are the ones that are losing. The insurance agents, we are on the front line of trying to make sure that whatever our clients receive as far as a balanced bill, that we help them to try to work through that, however that's worked through, and hopefully that they're not turned over to a collections agency or that they have to file some type of bankruptcy. In testimony this morning, I talked about the NPR report, several other reports that I have read about the fact that they are now saying New York's bill that was enacted in 2015 is increasing rates. And I know some of the legislators were hearing from the doctors and the hospitals saying that New York is saying that we're saving money. And there's questions, where is this bad information coming from New York? So I thought maybe I would address that in this video before House Insurance on Thursday and Senate Finance on tomorrow. First, I'd like to talk about a Brookings Schaefer health policy report that was done on October 24, 2019. It says that the New York Department of Financial Services, which the doctors and hospitals continue to point to, suggests that the state's arbitration process is substantially increasing the New York's pay of health care. It also says that exactly what I testified to. New York suggests that the claims are paid at the 80th percentile, and regardless if an insurance company wins the arbitration or if the provider wins the arbitration, the consumer is paying on the insurance side at least 3 times more than they would have. That's pretty black and white. And then what this review goes on to say is even though the New York Department of Financial Services says that the arbitration decisions are supposed to be on the 80th percentile, or it points to the 80th percentile, the average has been 8% more. So if you look at some of these graphs, you will see that people are being paid on the insurance or the provider side, and the consumer continues to lose. Also, it says the New York report estimates, and the doctors and hospitals pointed to this several times, so they're not lying, that it saved consumers over $400 million. But remember what Dr. Phil says: when you say but, everything before is gone. But there is no supporting evidence proved in actual data released in the report that they report that suggest that this is true. It says that the opposite is true. So definitely providers, they're getting their information from this, but those entities that this is not the only report I'm going to point to are absolutely saying that this is not true. It goes on to say consumers and taxpayers appear to be losing in either instance. That even arbitration's decisions in favor of the health plans on average are 11% below the 80th percentile, are still far above in-network rates, implying that health plans only win in the arbitration where they offer to pay extremely higher rates. Again, more graphs that really go into detail. There was also, and I hope I heard this incorrectly, but I thought that there was testimony that said there were less arbitration claims each year. This is saying they are seeing more bills every year. So each year they're seeing more and more claims that are being brought to the arbitration process. So that's Brooks. The other thing that I've been pointing to for several days is the NPR Kaiser report. So you guys know me. Hopefully the legislators will learn to know that I just don't point to one piece of information, that I dig and find more. The NPR report says healthcare cost went up. In 2015, of course, New York passed this arbitration, and basically it says the same things that the Brooks-Schaefer report says, that people are paying more. According to analysis, the number of bills undergoing arbitration went from 115 in 2015 to 1,014 in 2018. I would say that was a significant increase. And then I know there are folks that keep pointing to federal legislation. And in this specific NPR legislation, this article, it states that Senator Cassidy and Senator Hassan from New Hampshire both were quick to draw their distinction between their arbitration bill and the New York's model. Senator Hassan said the New York system uses as a payment standard bill charges which we think is wrong and misguided. It's right here. I highlighted it in pink. So, of course, in this NPR article, it talks about the fact that Cassidy and Hassan think their bill is better than the Senator Talbot arbitration New York style. I've had input from our New York agents who are upset about the New York bill and would like to know how we can go, well, it's not a bill, it's law, how we can go in and change it and amend it and make it better because it's not working in New York. I also have articles from Fierce Healthcare, from Forbes. I mean, it goes on and on and on. And I'm going to bring this tomorrow to the Senate Finance and again on House Insurance. But I need your help as agents and brokers. I need you to reach out to the senators on Senate Insurance. Senate Financial. It has a big CBO score because it's going to increase rates. If it's not working in New York, why would we pass it in Louisiana? We have enough problems. I ask that you reach out to the House Insurance Committee. Explain to them that we really do have balance billing problems, that you really are on the front line, and that New York is increasing rates. And let's work with Representative Freeman, who is trying to take both sides. Now, I was impressed with the insurance companies that said, look, we're in it to win it. We don't like arbitration, but we'll go there. The provider side said that they were willing to work, but they weren't so keen on the legislation. And Representative Freeman was totally right. If he passes something, neither side is going to be happy. The only person that's going to be happy is the ball. The ball is going to be happy. We still are going to get hit in the game. However, we'll be taken out of balance billing. Our clients will not get charged a balance bill, a surprise bill, when they choose the right doctor, the right hospital, and mysteriously a non-network doctor puts them to sleep, reads their radiology or their pathology. It wouldn't happen. And on the opponent side, we continue to have a very nice doctor talk about he's an emergency doctor, he doesn't balance bill. I'd like to hear some testimony from the anesthesiologist that charge 6 times what other in-network anesthesiologists are charging. Let's hear from some of those folks on why they do balance bill so we can get down to the root of this problem. Again, insurance agents, we're not pro-insurance agent, insurance company. We're not pro-doctor, hospital, except we want them to keep us alive and we don't want them to balance bill us. But absolutely, we are the ball. We are representing the consumer. We are trying to get the point across. Let's pass something that works for all parties, that takes the consumer out. But the New York style arbitration on everything you can read and investigate has increased the rates. They have hard data. They know it's been in place since 2015. So please, if you're unsure who to reach out to, send me an email. If you're a legislator and you're watching this, thank you for everything that you do. Hopefully this has cleared up some of the confusion. It is confusing, but I'm here to tell you what and how the consumer feels. So have a wonderful day. The Capitol's going to be crazy this week. I'm excited, except for the mask almost suffocates me. But again, thank you. I'm honored to be your CEO and the leader of the Freedom Fighters. Ronell Nolan, HAFA.